It can be difficult to move a patient from a bed to a chair or stretcher in a hospital setting. Patients who cannot walk or put weight on their legs will need to be transferred frequently at home. You will need to transfer your patients correctly so they are not at risk of being dropped or injured further. It will be a safe process for you and the person you are caring for if you learn the correct techniques. So, we are going to watch about the how to safely transfer a patient.
Method 1. Preparing for the transfer.
First is wash your hands with antibacterial soap and water. Lather your hands with the soap and wash them for 40 to 60 seconds. This will ensure you are touching the patient with clean hands and are not exposing them to any germs.
Step 2. Tell the patient you are transferring them.
Explain the steps you are going to take to transfer them to a chair or a stretcher. This will prepare them for the move so they are not caught off guard.
Step 3. Identify the patient's dominant side.
Hold the patient's hands, placing one hand in each of their hands. Ask the patient to squeeze your hands as hard as they can. Notice if one side feels stronger in your hands. Finally, check that the transfer area is free of any obstructions or slipping hazards. You should be wearing non-slip shoes to ensure you have a solid grip on the floor. Look around the transfer area for any loose cords or tubes and adjust these items so they are not in your way.
Method 2. Lifting a patient into a chair.
First is place the chair next to the patient's bed on their dominant side. If there is an arm guard on the bed, lower it so it is not in the way. Make sure the chair is within arm's reach of you so you can get to it easily. Step 2. Use your hands to roll the patient onto the same side as the chair. Try to roll the patient as close to the edge of the bed as possible. Gently turn the patient so they are on their side, facing the chair. Ask them to keep their arms tucked into their chest or under their head. Step 3. Swing the patient's feet off the edge of the bed and move them into a sitting position. Bend your knees as you swing the patient's feet off the edge of the bed. Shift your weight to your back foot and gently ease them into an upright sitting position. Place one arm under the patient's shoulders and one arm behind their knees.
Step 4. Lower the bed using the bed controls.
Shift the patient to the edge of the bed and lower the bed so their feet are touching the ground. Make sure you support the patient's upper body with your arm as you lower the bed. Step 5. Put a gait belt on the patient if they cannot stay upright on their own. The gait belt will also give you a better grip during the transfer so the patient does not fall out of your arms. Wrap the belt around the patient's waist so it is snug, but not too tight. Tuck any extra fabric at the end of the belt into. Step 6. Lock your hands behind the patient or at the gait belt. Stand as close as possible to the patient and reach around their chest with your hands. Lock your hands together behind the patient, at their mid-back. If they have a gait belt on, you can hold it between your hands and line up your arms to create friction.
Step 7. Place the patient's outside leg between your knees.
Make sure the patient keeps their hands by their sides so they can support themselves when you lift them. The patient's outside leg will be the leg furthest from the chair. Position their leg between your knees for support and bend your knees, keeping your back straight. Telthe. Step 8. Stand and lift the patient, pivoting towards the chair. Count out loud, 1 2 to 3. On 3, slowly stand up, using your legs to lift the patient. Shift the patient towards the chair.
Finally, lower the patient into the chair.
Once the patient's legs touch the seat of the chair, bend your knees and slowly lower them into the seat. Have the patient reach for the armrests to support themselves as you lower them down. If you are lowering them into a wheelchair, you can then reposition. Method 3. Completing a pivot transfer in and out of a chair.
First is park the wheelchair next to the bed.
Make sure the bed is lowered so that it is level with the chair. Explain to your patient that you are going to move from the bed to the chair, or from the chair to the bed.
Step 2. Help your patient sit up from the bed.
If your patient is moving from the bed into a chair, have them sit up. If they seem dizzy or start tilting, steady them and let them sit unassisted again.
Finally, help your patient stand up.
Instruct your patient to push up with their hands, leaning forward over their feet. If your patient is not dizzy or tilting, help them complete a pivot transfer. Make sure to keep a hold on the gait belt to prevent your patient from falling.
Method 4. Moving a patient to a stretcher. First is get one person to assist you.
You will need another person to help you support and lift the patient onto the stretcher. Have them stand on the opposite side of the bed so they can support the patient on the side opposite from you.
Step 2. Line up the stretcher with the patient's bed.
Make sure top of stretcher lines up with top of patient's bed. Then, raise the height of the bed so it is 1 to 2 inches, 25 to 51 millimeters higher than the stretcher. Step 3. Shift the patient to the edge of the bed and roll them away from you. If the patient can move on their own, ask them to shift to the edge of the bed. Guide the patient onto their side, facing away from you. Have the patient bend their legs and keep their arms across their chest as they lay on their side. Step 4. Lower the guard on one side of the bed and place the slide board under the patient. Make sure the slide board sits under the bottom sheet so the sheet and the patient are both supported by the board. Make sure the area around the stretcher is free of any cords, wires, or tubes so you are not at risk of tripping. Step 5. Roll the patient onto their back so they are supported by the slide board. Check that the patient's knees are still bent and their arms are still firmly across their chest. Ask your assistant to help you by rolling the patient away from them, onto the slide board. Step 6. Slide the patient onto the stretcher with the help of your assistant. Tell the patient that you are going to slide them on the count of 3. Have the assistant lower the guardrail on their side of the bed. On 3, slide the patient across the slide board, onto the stretcher. Finally, remove the slide board and position the patient comfortably on the stretcher. Raise the guards up on the stretcher so the patient is supported. Leave the slide board on their bed. Roll the patient onto their back and slide a pillow under their head so they can rest comfortably.
We hope it is useful to you. Please subscribe to our channel to upskill yourself.